If you're suffering from elbow pain on the outside, known as lateral epicondylitis or epicondylalgia, as well as tennis elbow or a tendon pathology on the outside here, I'm going to show you some tips you can do at home to try to reduce your pain, improve your strength, and return back to functional use of your upper extremity. First, we're going to perform wrist extension exercises using a small dumbbell. Now, I have this small bolster here, and you can use a towel at home and roll it up, or a washcloth, or just anything where you can just prop the forearm up in this position. So what I'm going to do is take the dumbbell, I'm going to bring my wrist back. You should feel this on the outside of the elbow. It's okay if you have pain with this. In fact, I don't expect you to be pain-free while you're going through this program. In most cases, people that have a tendinopathy or tendinitis do have pain while they're going through their therapy program. In fact, if you don't have pain, you probably are not loading the tendon enough. So we're just going through this nice and slow. There is some research that will say that going through eccentric movements are more beneficial. That's where you use your other hand to pull your wrist back. You're going to slowly hold that and then just lower it down. You get to the bottom, use your other hand to kind of pull that dumbbell back and then slowly lower it down again. To me, it doesn't really matter. If it's too painful just to go through the movement on your own, you can use the other hand to bring that back and then slowly come down. And I perform somewhere between 2 to 3 sets of 10 to 12 repetitions of this exercise. Now we're going to perform wrist flexion. So I have my hand now palm side up. I just rolled over in this position, and I'm going to go into wrist curls or wrist flexion here. I'm just going to come up. You're going to feel this on the inside of the elbow. Now I know that the inside of the elbow here is not where the pain is. This is on the outside, but we want to strengthen the entire forearm area, elbow, wrist, and also a lot of people notice loss of grip strength with this, and so we just want to make sure that we're performing strengthening exercises on the entire area. So we're just going to go through this again, 2 to 3 sets of 10 to 12 repetitions. Now we're going to perform radial deviation. So I'm going to take the dumbbell just like this, and I'm going to pull it back just like this, kind of going like I'm hammering a nail. You're going to feel this on the outside of the forearm here. And I complete 2 to 3 sets of 10 to 12 repetitions. Again, it's important to remember that it's okay to have pain with this. As long as your pain calms down and doesn't stay at, say, an 8 or a 9 out of 10, it calms back down to kind of where you were at baseline when you started your exercises. That's perfectly normal. These are finger extensions using a finger extension band. So you're just going to pull this apart just like that. You're going to feel that all down the back side here, the back of the hand, the back of the forearm, and I complete 2 to 3 sets of 10 to 12 repetitions. There's a whole bunch of different places that you can get these. I'll put a link in the description for these. You can get them in sets where there's different levels of resistance, from easy to harder resistance. I really like those, and I think that's a hard exercise to replicate sometimes, although you can take just a rubber band, wrap it around the outside of the fingers and hand, or even one of the small exercise bands that you use for other parts of the body, wrap it around and then work on it to try to get as close as you can to one of these. Now we're going to work on grip strengthening, and so this is a hand gripper here. You can get a whole bunch of these different places. I'll put a link in the description of this one. And so you just squeeze here just like this. You're going to feel it on the inside of the elbow. And I complete somewhere between 2 to 3 sets of 10 to 12 repetitions. This is instrument-assisted soft tissue mobilization, or using a scraping tool. You can get these a whole bunch of different places. You can pay a lot of money for them or just pay a little bit. I prefer to pay a little bit because you don't need something that's hundreds and hundreds or even thousands of dollars. And I'm just going to take this and go over the area where it's painful and irritated. I'm going to go kind of back and forth, all different directions. I'm not using lotion initially because I want to cause a little bit of a shearing effect, a little bit of light micro trauma to the area. Be careful because the radial nerve does sit in here. So if you're getting a lot of tingling sensation when you're doing this in the back of your hand and finger, just be cautious of that. You can use a little bit of lotion. In fact, I would initially start just, no lotion going all around. Then you can put a little bit of a lotion or emollient on that and just kind of go over the whole area for maybe to try to help with a little cortical mapping. Plus it feels pretty good. There's a little pain relief with that, some decrease in pain sensation. I also like to take a tennis ball. You can take a tennis ball and just hold pressure on the area that hurts. That usually feels pretty good, kind of that hurt so good sensation. So I'm just taking the tennis ball, going over the areas that are painful, and I'm pressing in. I may work it back and forth a little bit, make circular patterns. You can even take this and put it against the wall. So I have the tennis ball here and I push against the wall with it. So you can do that to hold pressure just to try to get some of the muscle tone to kind of decrease and desensitize the area. You can also use one of those tennis elbow straps that come around, and basically what those do is you put those below the spot. So if you hurt right out here and this is where the pain is, you're going to put that just below that. You strap that on. You have to be cautious with that because sometimes you can irritate the radial nerve because of, the nerve running through here. So you want to be careful not to get that too tight. If you don't have a brace, you can take some tape, or this is a Coflex or Coban, that sticks back to itself. And so I'm going to say the pain is right here. I'm going to go right below that, wrap this around, make a few wraps around my arm here, tighten it up, and then that creates kind of a false attachment point. So it takes some of the pressure off of the tendon right here and kind of focuses that more under the strap. So you can do that to get some temporary pain relief with that. Another thing that I like to do is take kinesiology tape. Now this isn't a cure-all or a fix, but a lot of times it will give some support, makes it feel a little bit better and a little more manageable throughout the day. So what you do is you take this and you cut a slit in the tape. So what I'm going to do is pull this apart, and I have this little slit in this, and the reason for that is so that it fits over my middle finger here. So I'm going to put it over my middle finger. Now you can put this on, it can be on the index finger, whatever, but we're going to put it over my middle finger and get it to stick here. It's like sticking back to itself. And then I'm going to pull the tape off, or the backing off of the tape, and I put that, and I just run this down my arm. As far as like the position of your wrist, you can have it neutral, you can put it in a little extension, whatever feels the best to you. I'm just going to run this right up my forearm like this, rub it, get it to stick down really good. And so that will provide sometimes a little extra relief as far as running down through the tendons, the inflamed tendon area through here. So I do like to use kinesiology tape just as an adjunct to everything else I'm doing. The last two things we're going to do is going to be a stretch, and so you're going to go into a wrist flexion position. So the wrist is bent down. You're going to take your other hand and push back. You're going to feel that stretch across here, that area that's inflamed and irritated. You can also apply a tractioning force, so go just below this bony spot right here, just below that, and pull straight out like I'm trying to pull my hand straight off. Pull straight out like that. At the same time, bend and stretch down. That may take a little pressure if you have some discomfort here in the wrist just by pushing that down, because that can be a little uncomfortable, get a little pinch there. So traction that and pull when you go down. And typically you hold those stretches for 10 to 30 seconds. Repeat that several times, just kind of throughout the day. Our last movement is going to be a radial head mobilization. So what you're going to do is you're going to come right past the elbow right here. So in this area, just past the bend of the elbow, you're going to take your thumb and you're going to come around, take your thumb and press down right on, you'll feel that bone right there. That's the radius bone. So you're pushing down. If you can see that, you're pushing down there. I'm going to push straight down in that direction towards the table. Not really hard. I'm just pushing down for a little bit of radial head mobilization. So I can push down and hold that. I can oscillate that. I can go back and forth several times just pushing down. There's been some research that supports radial head mobilization can have an effect for tennis elbow or lateral epicondylitis pain. Thanks so much for watching. I hope this video helps to reduce your pain and sensitivity that you're having out here on the outside of the elbow, and then improve your strength and overall functional use of your upper extremity. Thanks so much.